Drew, thinking about moving into talking about acute myelogenous leukemia or AML, would you want to start us off with talking a little bit about some of the epidemiology and other characteristics of the disease that we might be thinking about?
The first one we're talking about here, acute myelogenous leukemia or AML, it accounts for over 80% of acute leukemia in adults. This is the adult one versus ALL, which we'll talk about kind of next. Tends to be a little bit more common in men than women. But here we have an increase in the number of immature myeloid cells in the bone marrow, the blasts, like we talked about, leading to that bone marrow failure progression. And kind of like the signs and symptoms are a lot of stuff that I've talked about, but here with the acute, it tends to be a more rapid onset of symptoms, right? The fatigue, the unexplained weight loss, maybe anorexia, fever, infections. You might get that strawberry red gingiva, gingivitis secondary to leukemic infiltration or mucosal bleeding. And as the bone marrow acutely gets compromised and we see that pancytopenia, we may see coagulation issues as well as even developing, kind of the serious condition of DIC, or disseminated intravascular coagulation, a very difficult thing to treat